Welcome back. In this video, we'll be discussing task shifting, an essential strategy that helps non-specialists manage depression, particularly in settings where mental health professionals may not be readily available. Task shifting involves transferring certain tasks, typically performed by specialists, to non-specialists like community health workers, nurses, or social workers. By empowering non-specialists with the knowledge and tools to manage depression, we can expand access to care and make a significant difference in mental health outcomes, particularly in underserved or resource-limited areas. Let's begin by understanding what task shifting is. Task shifting is the process of redistributing tasks from highly trained professionals, such as psychiatrists and psychologists, to individuals with less formal training. This is particularly valuable in low-resource settings, where mental health professionals may be scarce. By utilizing non-specialists, healthcare systems can increase capacity, improve access, and provide timely care to people experiencing depression. Why is task shifting important in managing depression? Depression is a prevalent condition worldwide, and it often goes unrecognized or untreated in low and middle-income countries due to limited mental health resources. In these regions, there may be just a few psychiatrists or clinical psychologists for a large population. This creates a significant gap in care. Task shifting addresses this gap by enabling non-specialists to screen, identify, and treat depression at the primary care level. Non-specialists can be trained to conduct basic assessments, screening interviews, and follow-up care. They can also offer psychosocial interventions, such as cognitive behavioral therapy, CBT, or behavioral activation, which are evidence-based and effective in treating depression. Task shifting helps ensure that depression is treated early and comprehensively, even when specialist care is unavailable. Let's talk about the training process. Training non-specialists to manage depression requires a structured approach that covers several key areas. Basic understanding of depression. Non-specialists must first learn what depression is, its symptoms, and how it affects a person's emotional, cognitive, and physical health. This includes recognizing signs such as persistent sadness, loss of interest, fatigue, and sleep disturbances. Screening and diagnosis. Non-specialists need to be trained in how to use screening tools like the PHQ-9, Patient Health Questionnaire, to assess depression severity. These tools allow them to identify individuals who need further intervention and refer them to specialists if necessary. Treatment protocols. Non-specialists must be equipped with knowledge on how to manage depression. This includes providing psychosocial interventions such as problem-solving therapy, behavioral activation, and basic counseling. Non-specialists should also understand the role of antidepressant medications and be able to provide basic education about medication adherence. Recognizing red flags. It's crucial for non-specialists to know when to refer patients to a specialist. This includes recognizing severe depression, suicidal thoughts, or psychotic symptoms that require immediate professional attention. Ongoing supervision and support. Training should be complemented by supervision. Non-specialists need regular guidance and feedback from supervisors to ensure they are providing effective care. Supervisors can help troubleshoot challenges, provide emotional support, and offer mentorship during difficult cases. Reflection questions. Why is it important for non-specialists to receive structured training before managing depression? How can task shifting improve access to mental health care in low-resource settings? Now let's talk about supervision. While training is essential, it's equally important for non-specialists to have ongoing supervision as they begin implementing what they've learned. Supervision ensures that quality of care is maintained and that non-specialists feel supported as they take on new responsibilities. Supervision can involve regular check-ins. Supervisors should have regular meetings with non-specialists to discuss cases, address concerns, and provide emotional support. These meetings allow for problem solving when challenges arise and help identify areas for improvement. Case reviews. Supervisors can review specific patient cases with non-specialists to ensure that the correct treatment is being implemented. This might involve discussing treatment progress, changes in symptoms, and whether a referral to a mental health professional is necessary. Skill-building workshops. Ongoing supervision often includes workshops or refresher training on key therapeutic approaches like CBT and problem-solving therapy to reinforce skills and keep non-specialists up to date with the latest best practices in depression management. By providing ongoing supervision, healthcare systems can ensure that non-specialists are equipped to manage depression effectively, while also preventing burnout and improving job satisfaction. Reflection questions. What are some ways that supervision helps maintain the quality of care provided by non-specialists? How can regular feedback from supervisors ensure that depression management is effective in non-specialized settings? Let's now discuss the potential impact of task shifting. Task shifting has several advantages. Improved access to care. By training non-specialists, mental health care becomes available at the primary care level, ensuring that people don't have to wait for specialized care. Cost-effective. Training non-specialists is often more affordable than hiring additional mental health specialists. This allows healthcare systems to allocate resources effectively, especially in low-resource settings. Better health outcomes. Task shifting increases the likelihood of early diagnosis and treatment of depression, improving outcomes for individuals who might otherwise go untreated. Reflection questions. How can task shifting help healthcare systems address the shortage of mental health professionals? In what ways does task shifting lead to better health outcomes for individuals struggling with depression? In summary, task shifting is a powerful approach to managing depression in non-specialized settings. By training non-specialists, such as community health workers, nurses, and social workers, these individuals can provide effective depression care, screening, and psychosocial interventions. Ongoing supervision ensures that the quality of care remains high and that non-specialists feel supported in their roles. By integrating task shifting into healthcare systems, we can provide accessible, effective mental health care to a wider population, especially in low-resource settings. In the next video, we'll explore community support and how to mobilize family and social networks to help manage depression. Let's keep it going, and I'll see you in the next one.